A couple of other colleagues have mentioned Journavax, which is the new drug that has been introduced for acute pain that is non-opioid based. And this is the fruits of 2 decades worth of biomedical research that my Republican colleagues are trying to cut. And it is going to be, I think, a game changer. 40 million Americans are diagnosed with acute pain every year. 85,000 of those develop opioid use disorder. And this drug is similar in its efficacy for treating pain without being addictive. Now, the problem is the commercial health plans are creating the generic level copays for this drug. But on Part D, where millions of Americans access their prescription drugs and where a lot of people with acute pain will get their drugs, the copay is at $50, more or less, whereas the opioid copay is at about $2. Based on your experience dealing with patients with acute pain, do you think that difference in out-of-pocket costs might disincent the use of the less addictive painkiller?
Yeah, I always, when I prescribe medications for people, I always just start with something even more simple than that, than anything prescription. Tylenol and ibuprofen together, if you can take them, are as effective. But I think, yeah, definitely cost is a driver of what patients take. If they can get something for $2 versus, $50, there's going to be a shift towards the less expensive.
Ms. LaBelle, would you agree that a higher copay is disincenting exactly the behavior we want to see?
Sure. I mean, people are cost sensitive, and that's a lot of money.
That's a lot of money, and we know that anything particularly above $35 copay tends to really rapidly disincent patient adherence. This is an example, again, of the pharmacy benefit managers, the health insurance-owned drug pricing middlemen, not enacting and enforcing their formularies in a way that is actually helpful to public health. They are directly undermining public health by pushing the opioids, and by the way, there's huge evidence that the PBMs profited off of the overprescription of these opioids. They are continuing to push these opioids onto Part D beneficiaries, despite the fact that there is a brand drug out there that is non-addictive, that treats pain similarly, and that they could easily put forward at the same copay tier if they wanted to.